My name is Adeyabeba Lowrie. Most people know me as Mimmi. I am a student at the School of Nursing graduate division. I'm going for my advanced practice registered nurse certification with a specialty on occupational and environmental health nursing. I worked as a nurse for 18 years before I applied for the program. So I've been now a nurse for the last 20 years. Ever since I got my bachelor's degree, I have known that I wanted to go back for more education. I'm a junkie that way. I love learning. So I just decided, if I don't do it now, I'll never do it. So I applied and luckily I got accepted. But the occupational and environmental health aspect of the education was actually a surprise twist, because as I was getting ready to apply, I shared it with some people at work and they told me, oh, hey, do you know that they have this specialty to the APRN? And I did not. So I said, that would be great. Because the more you learn about, being a practitioner, human beings are, complex, right? So, and work affects us, our health, the way we are. So I think knowing human beings in a diverse way would help me grow better. So I said, yeah, I will apply for it if I can get into that too. And I did. So I'm so fortunate. My favorite part is the interdisciplinary aspect of the program. We are all basically have a little expertise or great expertise in the area of our own majors, but however, we don't know what other people do in this occupational or environmental health sciences area. And therefore, when you have all of these people in the same room from different parts, they all bring in their specialties, and it's like having, a group of referrals right there for you. So if you don't understand something, you can ask. And then our faculty is just phenomenal. They have, vast number of years of experience in their specialty. And again, they are like our encyclopedia. So I just felt like we had a tremendous amount of educational opportunity. And then they invited speakers. We had the conferences that we would attend, and even though there are speakers assigned, at the end of it, we are all participating. So everybody has to give a little bit of input. So no little idea is little, because when somebody says something, what they think is little, the rest of us are learning. So it was a very good way of learning. If you think about it, if you're spending about 8 hours of your day at work, that is a vast number of time you spend at work. So knowing what people do for a living and what that choice for a profession, how it affects their health or how it contributes to the illnesses that they might have, could only make me be a better practitioner, because I would hopefully understand the patient as a whole. Therefore, I think it gives me a leg up just to know, if they work in this area, there's a risk for this. And if they work in that area, if there's an injury, it's because of this. And maybe we can modify, something that they do. So it just gives you an insight to the patient that you would not have had otherwise. Well, I love that aspect. So my advice is apply for it. Please try to get in. It's just going to give you a leg up, a boost in your knowledge. It gives you a better understanding of your patient, the population that you serve. And even if you do not pursue the path of occupational and environmental health, in any clinic you apply in the case of the APRNs, it is going to be a very useful tool. So it will benefit you in just having a very well-rounded viewpoint.